Good afternoon, everybody. And myself, Dr. Muralidhar, Associate Professor of Ophthalmology at All India Institute of Medical Sciences, Mangalagiri, India, an institute of national importance. Today, I'm going to present my talk is Roth spots, which are retinal hemorrhages, which we see in the eye, as they serve as a clue to underlying acute myeloid leukemia. No, it's not coming. Yeah. Introduction. Roth spots are white-centered, oval or round retinal hemorrhages present in the superficial layers of retina. They can be clues to underlying systemic diseases such as infective endocarditis, leukemias, vasculitis, anemia, and thrombocytopenia. Any of the disorders may even present. Sometimes in all these conditions, Roth spots may be present in the case of retina. This study highlights the importance of identifying the Roth spots in the fundus picture, which help to uncover the diagnosis of AML, acute myeloid leukemia, through further investigations and giving appropriate treatment to the patients. The case report. Let me tell you elaborate about the case. A female patient who is a homemaker in her early 30s and of Asian origin came to our specialist ophthalmic outpatient clinic with chief complaint of sudden decrease in the visual acuity of her right eye for 4 days. With 4 days duration, chief complaint is sudden decrease in visual acuity and she has generalized weakness, palpitations and black stools. But the patient presenting symptom is sudden loss of vision for about 4 days. So she came directly to our ophthalmic OP clinic. Her vision recorded by Snellen's charts in her right eye was counting fingers 1 meter and in her left eye was 6/6. Intraocular pressure recorded by applanation tonometry was 14 millimeters mercury in right eye and 15 millimeters mercury in the left eye. The color vision recorded in both eyes by reading the Ishihara's charts was right eye is 0/25. Vision was dropped and the color vision is 0/25 and left eye is 25/25. Left eye is looking perfectly normal. Then the pupillary reactions in the right eye were relatively afferent pupillary defect RAPD grade 1 is present, and in the left eye pupils were normal size and reacting to light. The case report. A slit lamp examination had done and there is connoted conjunctival pallor in both eyes. The cornea, anterior chamber and lens were within normal limits in both eyes. The fundus examination revealed a detailed fundus examination with +90 diopter lens revealed the presence of Roth spots, subspecies. These are the Roth spots and big subhyaloid hemorrhage near the macula of thickness of right eye. And the fundus, this is the fundus picture of the left eye, where the media is clear and able to see the big hemorrhage and few Roth spots, the white-centered hemorrhages. This person. The peripherals, by seeing the Roth spots, first we had, apart from the ophthalmological examination, evaluation, we doubted anything, so we had done the peripheral smear examination. The peripheral smear examination revealed anemia, thrombocytopenia, and 10% blasts are seen in the peripheral blood picture of the patient. So bone marrow examination was advised. We referred the patient to the physician, attending physician. The physician has, after seeing the case of the blasts, he told that, okay, bone marrow also can proceed with bone marrow aspiration for the patient. And bone marrow aspiration showed increased cellularity with 58% of the blasts, which were 2 to 3 times the size of small mature lymphocytes with round nuclei and 1 to prominent nucleoli and moderate cytoplasm in few granules. Therefore, the final diagnosis was given as the acute myeloid leukemia. And absolutely, it is not the presenting feature. The patient either had visited the physician or an oncologist just because of complaining of decreased vision in the right eye, sudden onset of painless progressive decreased vision. She referred to us to ophthalmic clinic. We had examined the patient and finally by noticing the case of the all picture we thought and blood investigation, we know we had seen the peripheral smear abnormality. We referred to the physician. Physician advised again bone marrow and finally the blasts were revealed. And final diagnosis is AML was given. So these are all the investigations. The hemoglobin, which is 4.1, these are packet cell volume, everything. These all investigations we had done in our patient. She was treated with, as there is anemia also, the patient was treated with 2 units of packed red blood cells and vitamin B12 injection was given to the patient. And currently, the patient is receiving a induction chemotherapy course by the oncologist. So the case was finally referred to medical oncologist, and he had done induction chemotherapy course with cytarabine and daunorubicin, and is being planned for reassessment bone marrow evaluation after completion of this course. Clear. So the subhyaloid hemorrhage in the right eye was not resolved and the vision is not improved. My job as ophthalmologist is I have to give vision to the patient. So I have been a vitrectomy was planned to give better vision in this patient. We have to probably compulsory we have to go for vitrectomy to remove the entire hemorrhage. It was planned once the disease has stabilized and approval should be obtained from the oncologist. That is the case scenario. So discussion. Roth spots are white-centered oval or round retinal hemorrhages which are present in the superficial layers, mainly surrounded around the posterior core. The white centers of the Roth spots may be due to the accumulation of the leukemic cells, fibrin or the platelets. These are present not only in infective endocarditis, mostly they are present in infective endocarditis and anemia, but it also present in the underlying systemic conditions such as leukemias. These retinal features or hemorrhages are most striking features of acute leukemia, and visual disturbances occur if the macula is involved, and poor prognosis in leukemia patients if they are detected in the fundus picture. Usually acute myeloid leukemia, and I have very less knowledge on the general part, maybe not be presenting with a sudden decrease in vision. Suppose if the retinal infiltrates, these white spots in the centers in the Roth spots are nothing but the leukemic infiltrate. Suppose if the patient had gone to that extent, even the prognosis of treatment of AIML is also poor. AIML is characterized, a few words about AIML, zonal expansion of immature blast cells in the peripheral blood and bone marrow, resulting in ineffective erythropoiesis and bone marrow failure. About 30 to 35% of adult patients have nucleophosphamine 1 mutations, and AIML may be associated with anemia, thrombocytopenia, retinal hemorrhages, mostly Roth spots. The exact pathogenesis of Roth spots in AIML is still unknown, but the proposed hypothesis may be attributed to the rupture of retinal blood vessels followed by aggregation of the fibrin platelets and white centers, mainly representing the accumulation of the leukemic cells. The purpose of this case report, why the case is being presented is to highlight that Roth spots can be observed not only in infective endocarditis, but it also present in systemic conditions like leukemias, hypertensive retinopathy, and other vasculitis diseases also. The presence along with subhyaloid hemorrhage, decreased vision, made us to advise a complete blood picture and peripheral smear examination. Even though investigations revealed anemia and thrombocytopenia suggest to have anemic retinopathy, we had treated our patient with packed red blood cells also, but the presence of few blasts in the peripheral sphere made us, and I mean my attending concerning physician, to go for bone marrow aspiration and flow cytometry test in the patient. Finally, the presence of 90% of blasts gave us the clue to diagnosis of AML. Anemia and thrombocytopenia may be the secondary to AML. Presence of ocular involvement in retina shows, as I had already told, aggressive systemic disease and poor prognosis. The conclusion. The presence of Roth spots along with subhyaloid hemorrhage in the fundus picture is one of the diagnostic clues for AML, even though it may look like anemic retinopathy. Because anemic retinopathy can be treated, but AML is itself having a little bit poor prognosis. A complete blood picture and peripheral smear examination are advised in such cases to look for any blasts to rule out leukemia, which is life-threatening. These sort of cases require a multidisciplinary approach, not by means of an ophthalmologist, but also a pathologist and oncologist, along with the ophthalmologist. And these are the references. And this is our All India Institute of Medical Sciences, an institute of national interest. I thank you very much for the organizers for giving the time.